महाराष्ट्र, मुंबई, ठाणे, रायगड, पनवेल, नवी मुंबई परिसरातील वस्तुस्थिती दर्शक घडामोडींचा वेध घेणारे लाईव्ह महाराष्ट्र 9.
They came to me in the OPD by hand by hand with their son, who is sitting just beside him, with severe osteoarthritis of both the knees. Both of them were crippled since last 15 years. They were managing with all sort of treatments that is available. So first to know what is osteoarthritis. Osteoarthritis is a condition of the joint where the cartilage is damaged. So we should be aware that the cartilage once damaged, it's very difficult to regenerate at this stage. Okay. So especially the weight-bearing joint part cartilage like in image here. Once the cartilage is worn out, the cartilage regeneration becomes very difficult. And we try to do all those methods by which the disease process can slow down. It can be slowed down, but it cannot be reversed. So they have tried all the methods by which the disease process can be slowed down, including multiple injections in the knees. So these are all methods other than the surgery. They will give you a short-term relief for certain duration. Yes, if you can give relief for a certain duration, that is okay, that is acceptable. And they are trying all the other methods. If the conservative measures of treatment fails, then total knee replacement and knee replacement is the only solution. And age is not a factor that this surgery cannot be done in this age, because osteoarthritis occurs in this age only. In younger patients like you and me, the osteoarthritis is not that common. Osteoarthritis is common in the elderly age. So the surgeries are done in the elderly people only. Main thing is what are the precautions we should be taking while operating in those patients, because after certain age the comorbidities will add on. Hypertension, diabetes, any other problems, they will add up on the risk factors for the surgeries. So it all depends on the patient's own courage, motivation, and counseling from the doctors as well as the counselors. Great help of the physiotherapists to make them confident for surgery, followed by the surgical team, including the anesthetist, will look after all the parameters during the surgery as well as after the surgery. So the surgeon should come when the cartilage is fully damaged, patient is not able to walk or walking with very much of difficulty. Surgeon's role is to operate, give a new knee, and rest of it is the patient, the physiotherapist, and taken care by the pain management team, including the anesthesia team. So we had this couple coming up from Hyderabad, operated. The first thing that hit in my mind was both of them were crippled in the same magnitude. The cartilage degeneration, the knee condition, everything was same, exactly same to each other. And the right knee was more damaged in both of them. And the thing they decided the first event, sir, we have come traveled from that far to get operated directly. So it's because one is the clinical condition, one is the social condition. Because whenever anyone wants to get operated in an elective manner, everyone might think, okay, I have to call my daughter or son or someone to look after my home, will take care after my fooding, and all these things, the household things. So they were already motivated enough that, okay, now there is no other option other than total knee replacement for them. Second, now they were courageous enough that they were ready to do the surgery both in the same admission. So we admitted both of them together, do a thorough clinical checkup so that the fitness won't be an issue, evaluation, and one by one, first father underwent the surgery followed by mom. Both of them underwent physiotherapy, both of them walked next day of the surgery, and both of them got discharged on same day. And after 10 days of discharge from the hospital, the sutures have been removed and they are walking comfortably. Rest you listen from them themselves and their son rather than from us, because it may be something exaggerated from the doctor point of view. Nowadays in literature also there is what called patient related outcome measures. The truth comes from the patient. Because I can claim that I did a wonderful surgery putting this large knee implant or this large surgery, that doesn't matter. What matters is patients won't respond. So let us hear something from Vijay.
It's been more than about 15 years that they are struggling with their mobility issues in terms of the knee. And we have done multiple consultations both at Hyderabad and some of them even at Bombay. I live in Bombay. So even last year when they were here, we have done a lot of consultations, and we have tried all multiple options in terms of what are all the be it injections or physiotherapy, everything that we have done. To an extent it was giving relief, but it's not a solution. But when I got the reference of Medicover from one of my I would say Dr. Deepak and their entire team, including physiotherapy team and everyone, I think the stay for the 10 days made us to learn a lot of these things in terms of how do we need to take care of them, how do we need to take care of them. So I think it's about a month now. Both of them are able to walk really very well. They're going through they're finishing their daily chores by on their own, and they are doing really very well. And it's I came here not to boast or anything, but it's with the gratitude that I came here to thank the entire Medicover team for solving my long pending problem of my parents' mobility issue. So thank you doctor, thank you entire Medicover team. While parents might have a little language issue in terms of speaking because they are Telugu speaking, so but they have prepared themselves to speak about a word. So
they have excellent support to us, which we cannot generalize.